Okay, hello everyone, and welcome to the second session of the AAMI Standards Insider webinar series. This is Amanda Benedict, Vice President of Standards at AAMI, and we thank you for joining us today. Some of you also attended our first session in September, so it's great to see you returning for today's update. For those of you who are joining us for the first time, the AAMI Standards Insider webinar series is intended to provide updates and information about activity across our standards program, and particularly developments that are relevant to multiple stakeholder groups. So as promised for this webinar, we're going to be doing a deeper dive into specific platforms, programs, and pieces of our portfolio that are of interest to the AAMI community. So for today's program, we wanted to share some updates about the AAMI Committee Central Platform and what's going on there. As many of you know, we started a transition over the summer, my colleague Anna Leggett will have some updates that she's going to share about that. We're also going to give a briefing of selected highlights of a few of the AAMI committees. Just want to give you some information about some activities that should be on your radar. We've also invited Randy Horton, who was co-chair of the group that put together the new AAMI Consensus Report, AAMI CR 510, which is a consensus report on cloud computing. We're also going to go a little bit into information about U.S. participation in international standards activities and the difference between participating in an AAMI group that serves as a U.S. technical advisory group and participating as a U.S. expert or a U.S. delegate. We'll give you a look ahead into standards activity that is coming in 2022 that you'll want to be aware of, and provide some information about some other AAMI news. So with that, I am going to turn it over to AAMI's Standards Program Coordinator, Anna Leggett, to talk about AAMI Committee Central.
Thanks, Amanda. So first, we'd like to announce that all committees have now, and working groups, have now been transferred to the new platform. So that means that all new work, documents, open ballots, and other current items will be posted there. Older materials will be available on the old Committee Central platform for some time, but we are working to transition all of those documents over to our new platform. There may be a few remaining work items in the old Committee Central, like unresolved ballots. However, if this is the case for one of your groups and there's an action that you need to complete, your standard staff liaison will be directly in touch. For the new platform, we have a variety of resources available to you to assist you with the transition and the learning curve that we know isn't always the most fun. There is a comprehensive training video that's posted both on our website under Committee Central Resources and on the landing page of the new Committee Central, which will walk you through the various functions of the platform in detail. Also available on our website on that same page is a list of FAQs, as well as a new training that will take you step by step through the voting process and using the voter comment spreadsheet. In the future, we will be adding resources for the new platform that will be available in a variety of formats, including live trainings, recordings, click-through tutorials, FAQ updates, and more. We will also begin offering customized comment spreadsheets that will be pre-populated with the ballot-specific information to help avoid issues with uploading and saving comments and hopefully save you all some time. We also plan to make improvements to the platform in the future, which will take into account the feedback that we have received. Additionally, we're going to be introducing a new iteration of the Standards Roster Manager, which will be under development soon. If you have any questions whatsoever about the function of the new platform or issues with your account, please refer to the resources on our website first. They are comprehensive and continuously being updated. If you are not seeing groups, cannot access the platform, or have feedback or suggestions, always feel free to reach out to your standards staff liaison or standards@aami.org. Thank you.
Okay, thank you very much, Anna. As Anna mentioned, please do not hesitate to reach out to us if you have questions about the new AAMI Committee Central Platform. We greatly appreciate everybody's patience throughout the transition. And as we all come up to speed on using the new platform, your feedback, your suggestions are always welcome, so please keep those coming. And we appreciate those of you who we have heard from as you've started to use the new platform. Okay, with that, I would like to transition into some of our standards program briefings. And first up is Cliff Bernier.
Hi, I'm Cliff Bernier, Director of Standards at AAMI in the cardiac device-specific area. We'll be giving you a snapshot of what's happening in the AAMI Cardiac Valve Prosthesis Committee. The Cardiac Valve Prosthesis Committee serves as the U.S. mirror group to the ISO TC150 SC2 WG1 cardiac valves working group and provides U.S. experts to that working group. Most of the work in cardiac valves is happening in the ISO working group, so the Cardiac Valve Prosthesis Committee responds to that work and develops U.S. positions, which then are approved by the TC150 SC2 tag and sent to ISO. So quite a few U.S. experts serve on the ISO working group, and most of the, well, all of the major manufacturers are represented: Abbott, Edwards, Medtronic, Boston Scientific, W.L. Gore, another big one from Italy, LivaNova, a number of smaller startups. Quite a few clinicians are involved. China, India recently has become active, Germany, Canada, Japan. So it's a very active working group. They have 4 documents, 3 in the 5840 series, general requirements, surgically implanted heart valves, and heart valves implanted by transcatheter techniques. Those were they've been around for a while and were recently revised in 2021. There was a call for clarifications on some of the requirements, and those have been reviewed by the ISO working group, and it was determined there were no patient safety issues. So those will probably be held for the next revision of the document. The active work now is centered on 5910, which was published in 2018, and that's on cardiac valve repair devices. And work is going on in engineering task groups and clinical task groups, and the U.S. participates in all of those. So it's a lot of work, and it's going to take probably another year or 2 to finish that revision. The next meeting of that ISO working group is in March of 2022. There are also smaller activities. There's a public available specification being developed to standardize cardiac valve sizing that was not provided in the 5840 series standards, and there was a real need for that. And there's a preliminary work item underway on applying risk management to developing heart valves, and that will address new devices, and there's a task group looking into that, and another task group looking into risk management applied to existing heart valves. And I should say, in the domestic side, on the AAMI Cardiac Valve Prosthesis Committee side, an education course is being developed with our education department to train on applying the 5840 standards to the development and manufacture of heart valves. And we're hoping that that can be rolled out in the spring of next year. And that's a quick overview of what's happening in the cardiac valve prosthesis space. Thank you very much.
Okay, thank you, Cliff. Next up, we have some information about the Medical Equipment Management Committee. Overdue Montanu is our Senior Director Standards at AAMI. He works on the general standards stream of standards and oversees that area of work. And he works directly with the Medical Equipment Management Committee. Overdue is in another meeting right now and wasn't able to join us. So I'm going to give a quick update so you're aware of what's going on. The committee has been diligently working on getting through the comments on the first committee draft ballot of the revision of EQ 56, Recommended Practice for Medical Equipment Management Program. They are hoping to have that completed by year's end. There will be another draft that is produced and likely will be put out for ballot in public review. They're also simultaneously working on a reaffirmation of ANSI AAMI EQ 89 scheduled maintenance performance testing procedures. That ballot has been extended to December, about the middle of December. So if you're a member of that committee and you haven't yet voted on the reaffirmation of that standard, please do so. A reaffirmation is a determination of whether a document should stay in place, whether it should undergo revision, or whether it should be withdrawn. Those are the options for a standard. In 2022, after the group is finished with this first round on EQ 56, they're going to turn their attention to EQ 110, which is a new standard being developed for guidance for healthcare technology management education programs. There's a first draft that has been issued to the committee. The committee has returned comments on that first working draft. So they'll be working through that to develop another draft. Most likely it will be another working draft, and we'll continue on that way until they're ready to ballot it and issue it for public review. So if you would like more information about any of these projects, or if you want to get involved in this, this committee, and we certainly welcome new participants at any time, I would recommend that you reach out to Overdue, or you're welcome to contact standards at aami.org, and Anna can put you in contact with Overdue about activity in the committee and how to join. With that, we're going to go into some updates on the AAMI Sterilization Standards Committee and the affiliated working groups. Always a ton of activity happening within this particular committee and its working groups that operate under its auspices. This committee, ST, serves as the U.S. tag to ISO TC 198 sterilization of healthcare products. Within the groups that serve as mirror groups to the ISO TC 198 working groups, there's a number of national adoptions that are in progress now or are going to start soon, reflecting new ISO standards that have just been published, some revisions that have been published. We also have, I should point out that this group, in addition to having US tag activity, also has AAMI only activity. So I'm going to start off some of the updates, and then we'll turn it over to my colleague Jody Allen here in a moment to go through some others. Under Sterilization Working Group 40, Steam Sterilization Hospital Practices, there's a new technical information report that's being developed, TIR 109, External Transport of Medical Devices Processed by Healthcare Facilities. In addition to the transportation aspects of it, there's also some packaging aspects to it as well. So if either of those are of interest to you, I recommend that you get involved with the development of this particular technical information report. They're also working on reaffirming TIR 79, which is the self-assessment audit checklist that was based on ANSI AAMI ST 79, the 2017 edition. That technical information report was issued in 2018, so it does not reflect the 4 amendments to ANSI AAMI ST 79 that were issued in 2020. We're also going to start a reaffirmation of ST 79 and its amendments. And again, reaffirmation is a determination of whether a document should stay in place, whether it's due for revision, whether it's due to be withdrawn. So we hope to get the committee, the working group's thoughts on what the next steps are going to be and when with ST 79, which we know is critically important to sterile processing facilities and healthcare facilities. If you're interested in getting involved, please contact me, abenedict at aami.org, or you can contact standards at aami.org to be connected with information about this particular working group. Now I'm going to turn it over to Jody Allen to talk about some of our other working groups under sterilization.
Hi. Thanks for dialing in today. My name is Jody Allen. I'm a director in the standards department here at AAMI, and I work as a staff liaison to a number of standards committees, including the Health IT Committee and the affiliated Health IT working groups 1 through 4, the Biological Evaluation Committee, which serves as the U.S. Technical Advisory Group, the ISO TC 194, and the affiliated working groups BE Working Group 1 through 17, as well as a number of sterilization working groups, including Sterilization Working Group 60, 61, 83, 84, 85, 93, and 95. And now I'd like to provide some brief information about some of those AAMI sterilization working groups. AAMI Sterilization Working Group 61, Chemical Sterilants Hospital Practices Working Group, is working on a revision of ANSI AAMI ST58. That's chemical sterilization and high-level disinfection in healthcare facilities. The working group will meet in January to discuss proposed text. STWG 84, Endoscope Reprocessing Working Group, is working on a new technical information report, AAMI TIR 99, dilators, transesophageal and ultrasound probes processing in healthcare facilities. And STWG 95, Water Quality for Reprocessing Medical Devices Working Group, is working on the elevation of AAMI TIR 34 to a new standard, AAMI ST 108, Water for the Processing of Reusable Medical Devices. The working group will meet in January to discuss proposed text. Thank you.
Okay, thank you, Jody. Next, we're going to have an update on the Sustainability Committee, and I'll turn it over to Chennai Magua.
Thank you, Amanda. Hi, everyone. Welcome. My name is Chennai Magua, and I'm Senior Manager in the Standards Shared Services Group. I work with the Shared Services team to provide support and distributing and managing committee action items and ballots, directing editorial requests and other assigned tasks. In addition, I am the staff liaison for the AAMI Sustainability Committee, which has published one technical information report, AAMI TIR 65, Sustainability of Medical Devices, Elements of Responsible Product Lifecycle. The TIR is now actually under public review, meaning that there is a ballot open for the committee to decide whether to reaffirm the TIR, to open it for revision as an updated TIR, or to upgrade it to a standard, or to withdraw it. The committee is approximately 30 members. Ivan Izzo of Mayor Connecticut's co-chair, but we welcome additional members who want to get involved in the committee's work. We are also looking for a second co-chair to work alongside Ivan Izzo. So whether it's deciding the next steps with the published TIR or proposing new projects, you can contact me at cmagua@aami.org or standards@aami.org to become a member. I can also share this information in the chat box for anyone interested. Thank you.
Okay, thank you, Chennai. And next, we have an update on AAMI TIB, and I will turn it over to Sam Alameda.
Good afternoon, everybody. My name is Sam Alameda. I'm the project manager with Shared Services, which supports the standards team. I am also the staff liaison for AAMI TIB and affiliated working groups, which serves as the U.S. tag to ISO TC 76. Transfusion, infusion, and injection, and blood processing equipment for medical and pharmaceutical use. There's always a lot of activity going on within ISO TC 76, which has 76 published standards and currently has 15 projects under development. AAMI TIB and affiliated working groups developed a U.S. position towards the technical matter under development in ISO TC 76. In addition to its U.S. tag role, AAMI TIB is currently working on a new technical information report, which is the first AAMI-only project for this group. It is AAMI TIR 112, Guidance for Closed System Transfer Device Testing with Hazardous Drugs. If you're interested in getting involved in developing AAMI TIR 112 or contributing to the U.S. position for matters related to ISO TC 76, please contact me at salameda@aami.org or standards@aami.org. Thank you.
Okay, thank you, Sam, and thanks to the AAMI team for providing those updates. Now we wanted to go into a deeper dive on the new AAMI CR 510. So we have with us today Randy Horton, Vice President of Solutions and Partnerships at Orthogonal. Randy served as co-chair for the group that developed this particular consensus report. So Randy, I will give the floor to you.
Thank you very much, and thanks to all of you for your time today. We'll try and keep this moving at a good clip and try and cram a lot into a small period of time, and we'll talk a little bit about the consensus report, something about what's coming next, both in terms of things that were expected when we started the consensus report and things that were unexpected. And we'll try and have a little fun along the way. Next slide, please. So first, I want to say this is not my work exclusively by any stretch that we're presenting. There was a fantastic team that worked together on this consensus report. Their profiles are all up here. Particularly, I'll call out my co-chair, Pat Baird, who's been sort of my guide in this new world of medical device standards. Pat is currently enjoying a very well-deserved vacation in France. So I'm going to thank him. And we interviewed and consulted with a lot of people in industry along the way to writing this. I want to acknowledge that. Next slide, please. So you might reasonably ask, Randy, why did it take a group of seasoned industry professionals 18 months to write a document that was about 9 pages? And the answer I'll give is, to quote Mark Twain, I apologize for giving you such a long letter. I didn't have time to write a short one. In this case, we actually decided to take the time to write the short one because the challenge of figuring out what should be in a consensus report about using cloud computing in a medical device or quality management system was really figuring out what was it that was different. We knew things were different about the cloud, but we couldn't quite put our finger on it. And so figuring that out ended up being a challenge, and then writing that in a crisp and concise way took a lot longer than you might think it should. Next slide, please. So in the end, what we figured out was the scope of the CR and what we wanted to focus on, which is how do you maintain a validated state when part or all of your medical device or quality management system is operating on a third-party public cloud computing service like Google Compute or Amazon Web Services or Microsoft Azure. And we think believe this is a pretty pressing question because, like all other parts of computing, medical device computing is moving heavily onto public cloud infrastructures, and there's new challenges there that need to be addressed. Now, in addition to validated state, there are other topics that are very relevant if you're putting functions of a medical device in the cloud, things like cybersecurity or privacy. But those aren't necessarily uniquely associated with medical devices in sort of the framework we work within in the way that validated state is, which is why we're focusing on it. Next slide. Just to put, thank you. Just to put minds at rest, this is not replacement guidance. Everything we were working under before, we still are working under. This is additive guidance, or maybe I describe it as this is a lens to when you're using the cloud in your medical device, a cloud lens to apply as you're working with all of these other standards and regulations to help you think through what's unique about the cloud. Next slide, please. So some people have asked us, are you anti-cloud? Do you think that medical devices should not be using the cloud? And we'll stop and say no. We are hugely pro-cloud. We think cloud is tremendous. For our industry and every other one, it's really been a revolution, particularly for people who've spent a long time in computing and watched the evolutions of how do you do servers? How do you do server-side processing? How do you manage centralized databases? The cloud vendors have done something really unique, which is they have brought tremendous economies of scale to this space. They have made things that used to be a real pain to do computing. If you had a startup and you got $5 million to build a website, you had to drop your first $1.5 million just building out a data center or renting cages and buying a server. That's all gone now. And now you can really focus on the unique part of your computing, which is your medical device itself. And there are certain things, examples of why the economies of scale of cloud are great. Things like you are never going to pull in more redundant electric lines than a major cloud provider into their data center. And uptime's a pretty important thing for medical device connectivity. Think about a connected infusion pump. Similarly, you're probably not going to get faster or more redundant connectivity in your own data center than a cloud vendor is who's serving hundreds of thousands of organizations on that single data center. And you may have some very good cybersecurity professionals on staff, but chances are you can only afford a couple of them. And the major cloud vendors can literally have hundreds of top tier people who could be making upwards of $1 million a year, all focused solely on the cybersecurity of your systems 24/7. So we do see some great advantages for the stability we want in medical devices in the cloud. Next slide, please. But there are some things that are different, and it's really that you can't just take your medical device system and pick up the server and move it over to the cloud and install it and drop it and run. Because the main thing that's different is one of the things that makes the cloud so powerful is that basically the cloud providers take over a lot of the plumbing functions for you. So you're not worried about electricity and heating and cooling and connectivity or many of the functions of cybersecurity or patches or updates or operating systems or switches, you name it. And that's good because they can do it a lot better than almost anybody else can. They just have a level of scale that lets them do these things in a tremendous way and innovate very quickly. But it's also a lack of control. And for us in medical devices, we've been used to this idea that our medical device was something that we really controlled and nobody touched it or changed the inner workings of it without us saying so. So you could think of it almost like a castle. That people come to the device to use the device in the way that it's being provided in a controlled setting. And earlier on, a couple slides back, we had the picture of a container ship crossing the sea. And in many ways, that's more of a metaphor of what it's like now when you put your part of your device in the cloud. You're sending it out to sea. It needs to get from point A to point B. It needs to take the cargo safely on time. It needs to take the crew safely. But you don't control the weather. You don't control the ocean. You can simply prepare for the eventualities of it and be very intelligent in monitoring what's going on so you can avoid huge storms or things like that. But ultimately, you're in a much less controlled situation. And that's very true for the cloud also. And the biggest example of that is you don't get to control updates. Sometimes you'll get notified ahead of time for updates. Sometimes you get notified afterwards. The truth is sometimes there might be updates happening in your plumbing. You don't have control of it all. And those things could all change the functionality of your system, potentially in a way that's disruptive to the safety and effectiveness of your device. So next slide, please. Okay, so our second insight is that's not going to change. Even if the entire med tech industry came together and went to the large public cloud vendors and said, we want to change, we want you to stop doing updates until you check with us first and give us time to make sure everything's okay. That's not going to happen. First of all, we are a very small spec in the computing industry. We don't have the money to spend on it. And second of all, that's almost like saying we want you to uncloud the cloud, because the whole point is you're giving over to somebody else the plumbing control, so you don't have to worry about it. Think of it like a house. Somebody else is ensuring you've got electricity, water, internet connectivity, gas, basic utilities, clean streets, garbage pickup. That's what you're paying for, so you don't have to do those things yourself. And so next slide, please. The next insight that we have, and this probably felt like, I think, the boldest statement in our whole paper, the consensus report, was under these conditions, the best that can be achieved is an intermittently validated state. We cannot go about assuming that if part of our device is in the cloud, that we are in control of a validated state and nothing has changed on it without us saying so in the first place. Which brings us to the next insight, which is, next slide, please, sorry. That's okay. It's not an automatic deal breaker to say that we no longer have the control we used to, because there's trade-offs. In a lot of ways, we're better off. And it's okay to say, you know what, maybe we don't have full control of the computing of our device the way we used to, as long as we can acknowledge that fact. Let's admit we have a problem here. Let's admit that something's different, and then let's understand it and be smart about it and go through our risk management processes and all the things we normally do to ensure safety and effectiveness. We know how to do that as an industry. We just need to admit that there's something different going on and proactively be on top of it. Next slide, please. Because the truth is that in many ways, what we need to assume when you put your device in the cloud is the unexpected will or could happen again and again and again. And so you don't want to find out about it when somebody calls to tell you there's a problem. You want to be proactive about it and have a plan in place and be used to and have a plan for accounting for those changes and reacting to them quickly as a normal process as opposed to an emergency. Next slide, please. So we came up with 6 key recommendations for responsibly embracing the cloud for a medical device, and I'll say, or QMS as well. But when you look at these 6 items, I'm not going to bother reading them. We don't have enough time. This is nothing new. This is what our industry does all the time, right? We assess how we're going to use things. We look at the risk. We look at how often these things might happen. We figure out what could go wrong. We assess our vendors and suppliers. We come up with a plan, and we monitor our suppliers, and we monitor our system. This is something we're very good at. It's just applying it in a different way. So if you want to learn more about that, I highly recommend you read the consensus report. Okay, so next slide, please. So we were quite pleased, relieved, thrilled to have the consensus report go live. It's available for purchase now on AAMI's website. What's next? Well, we're out spreading the good word about this and trying to get adoption of this consensus report of the ideas, because like we said, there's already medical devices in the cloud. So we're already potentially at risk, but there's opportunity, and we would like to see these things used. A 9-page report is not enough to cover this topic. So we are in the process of, we've been approved for a technical information report. So sort of our baby consensus report is now going to grow up into a teenager technical information report, which will elaborate on a lot of these things. So the idea is to go deeper, give more tools that will help people figure out how to use the cloud. So we can say, okay, you need to assess the risk of your device in the cloud and what might break, and periodically check to see if something's broken. How often? I don't know, you figure it out. That's not a very satisfying answer. We'd like to have some tools that will maybe help guide people through decision trees on things like that. We showed the long list of other relevant standards and regulations. It'd be good to have some more detailed crosswalks to that. So just tools to kind of flesh this out. That's in the works. We are now calling for new participants for the TIR, so please join if you're interested or have thoughts or have input on things you would like to see in that. And the other thing I'll say that we try to do with the consensus report also is not speaking as AAMI, but speaking as the individual members of the committee, is to publish insights along the way, because nobody's waiting to put their device in the cloud until this comes out. It's happening anyway. So our feeling was that we would rather share some of the thinking, which is eventually incorporating into the consensus report of the TIR, so that people can discuss it and potentially use it earlier. Being very clear, we are not speaking for AAMI, we're speaking as members, but also people I think can understand that there's a good chance that some of these ideas are going to work their way into the, into the TIR in the future. Next slide, please. All right, so we're almost at a wrap, but one interesting thing that was unexpected happened as we were finishing up the cloud report. This is a nod for anybody who's seen the Broadway musical or film adaptation of the musical. It's terrific. If you haven't seen it, I recommend it. Funny thing happened on the way to the forum. Next slide, please. So modern computing, the things that make computers so incredible in the last couple of decades, it's hardware, software, data networking. It's all premised on distributed computing, that different things happen in different places. It doesn't all have to be on one server. And what we have is loosely coupled components, plug and play interoperability, so you can rapidly evolve and swap systems and try out new things. And that's what makes computing so remarkable. I think so many times we look at our smartphones or our computers or our Alexas and say, wow, this is just, it blows my mind where we are compared to whatever period of time before. And so when we came up with the 6 key recommendations that we showed here, we kind of had this moment, we looked at each other and said, this is not about cloud. These recommendations, these apply to almost anywhere where we want to apply a modern computing technique or tool or architecture to medical devices, because this idea of giving up some degree of control for a lot more functionality or quality is happening all over the place. And go to the next slide, please. We'll look at some examples. So we talked about third-party computing infrastructures in terms of the server, but also, you have a smartphone. We don't control which smartphones our patients use with devices, by and large. We may block them from using certain old ones, but we're no longer giving out a smartphone saying, okay, with my device, you're going to use this smartphone and you're going to carry around that plus your own smartphone for whatever else you use personally. There's over 80,000 unique combinations of smartphones in use in the United States right now, just in the US. That's a lot of variability to plan for. Third-party data and software services. You can think about things like if you're using weather.com data for pollution indexes to help advise you on a neurostimulator for dry eye disease, because the pollution impacts essentially the therapeutic dose you're going to take for a neurostimulation. Third-party biosensors, wearables, pulse oximeters, things that are measuring the gait on your body, geography, where you're driving, those kinds of things. Also, third-party artificial intelligence algorithms that you're consuming that can change on you, machine learning, or what you might call like an old school AI algorithm, like a clinical decision support tool. And finally, all these interoperable systems we're talking about, electronic health record systems, or if your device is bundled in a chronic disease management offering from a telehealth provider, those kinds of things. These are all places where devices are embracing these technologies, but we're losing control. Next slide, please. Sorry, I'm almost done. I think I may be running a minute over. So the bottom line, we've given this the nickname Tiny Gives, folks. This is not your grandmother's validated state. That was the insight, which is that this cloud realization we had applies to all kinds of things. And this challenge of innovation and technology innovation to the validated state is going to be happening over and over and over, which brings us to our next slide, please, which is, once again, that's okay. That's a good trade-off as long as we can admit that we're now in a period or an era of an intermittently validated state and be smart about it and plan for it and do the risk assessment and all the things we normally do. Because otherwise the option is to say, no, I'm never going to upgrade from my DOS computer to Windows. I'm going to stay on Windows forever. If we do that, we're going to end up working with legacy technologies that are increasingly unsupported, not being innovated on, and really limiting the tremendous value we can bring to our patients and providers for improving outcomes and bending the cost curve. Next slide, please. So this last insight is not yet speaking for AAMI in any way. We have not gotten this approved. We've been socializing this concept. We presented at the ISC, but I think our plan that we're working towards is to apply to AAMI for a consensus report around this. This is not your grandmother's validated state or Tiny Gives idea. It would be sort of a solar plexus that takes and extracts out the abstracts out, I should say, the concepts that apply anytime you're using some kind of third-party computing functionality or infrastructure in conjunction with your medical device, and how do you mitigate the risks and plan smartly around that and use that effectively. So we'll be looking at building on the work from the CR and the TIR and cloud computing, looking into these other computing domains like AI and learning how they're doing things. We're going to align with other evolutions in the med sector on computer software assurance, AI, cybersecurity, things, guidance around multifunction devices and interoperability. We're also going to look at other critical infrastructure areas because we're not the only ones using the cloud for critical infrastructure. You can think about nuclear power plants, automotive, logistics, all kinds of other areas to borrow from. And at the end, what we'd like to do is put out some best and worst practice guidance, maybe a set of recommendations that could be applied in something like we said that's a solar plexus that a lot of different standards and domains can refer to. So that's the current plan. Last slide, please. If you're interested in further reading, next slide, sorry. I forgot that one was in there. Further reading, we've got some reference materials for you, starting with the actual consensus report. And we are actively seeking people to participate in these efforts. We need smart people who are passionate and interested about this. So drop us a note. We want to know what you like, what you don't like, and what you want to see. Thank you.
Okay, thank you, Randy. Many thanks for your remarks today about the challenges and risks with medical devices increasingly moving to the cloud and the guidance that CR 510 adds to the rapidly growing area of computing and medical device QMS sphere. And we're looking forward to hearing updates about how the future work is coming along. Thanks again. Okay, with that, we wanted to shift into discussing a little bit about U.S. participation in international standards activities. This is an area where there tends to be a lot of confusion. I think most folks are aware that AAMI committees function as U.S. technical advisory groups, or U.S. tags, to ISO and IEC technical committees and subcommittees. And I think people are aware that it's these AAMI committees that are functioning as tags that develop the U.S. position towards technical matter that's under development within the international groups. So whether it's happening directly under the auspices of the technical committee and a project team, or whether it's happening in a working group. The U.S. tags and U.S. mirror groups propose U.S. experts to participate directly in the work activity. So participate directly in drafting standards and technical reports and technical specifications, for example. I should add here that ISO meetings are closed meetings. You have to be officially registered by your national standards body via nomination by the U.S. Technical Advisory Group in order to participate. And that's very different from participating in AAMI committee meetings, which are open. So it's a limited number of experts that can be reasonably and justifiably added to a working group. The rule of thumb is 5 experts per country per working group, and yes, there can be exceptions if they can be justified. And some examples of justification for having additional expertise is that there are different types of expertise needed. So you have to go to multiple experts in order to obtain that expertise. Or if a particular working group has a large number of active projects and it's a bandwidth issue, so you need more people to contribute to the development of those active projects. The U.S. Mirror Group determines whether there is need for new or additional U.S. expertise participating at the international level. So typically what we advise our U.S. tags to do, or U.S. mirror groups to do, is periodically take a look at the roster of U.S. experts that are participating at the international level, confirm that those folks are still available and willing to participate at that level, get a sense of what the projects, active projects are, what's expected to happen in the very short term, so that the mirror group can assess whether there needs to be replacements, whether there needs to be just new expertise needed, maybe the expertise has shifted, or whether we need to build a more robust roster of U.S. experts participating in those activities. There is a process for nomination and vetting of U.S. experts to put them forward to add to the working groups, and that's based on a number of criteria. We've developed guidelines to help guide these U.S. mirror groups as they're considering those folks who want to put themselves forward for consideration for nomination. And we should point out also that these are individual appointments. It's based on the individual's expertise. They're not organizational appointments. So there's not a reserved slot or slots for companies or organizations participating, say, in an ISO working group. And we know that is one big area of confusion. It's different participating in the AAMI committees, where you know that you can have a primary representative, an alternate representative, and a non-voting several non-voting representatives. So it doesn't function like that at the ISO level. Again, it's just a limited number that will participate directly in the international activities. So replacements, when they have to happen, are individual. And with all that said, we do have a long-standing custom in AAMI that the co-chairs of the U.S. Mirror Group typically serve as U.S. experts if they're available and if they're willing. And the idea is that the U.S. experts will keep the rest of the U.S. Mirror Group aware of the activities that are going on at the international level and reach back, use that dotted line of insight back into the U.S. stakeholder group to get a sense of what their U.S. colleagues would support within international standards development. Now, the U.S. Mirror Group's U.S. tags also put forward U.S. delegations to plenaries of the international committees, and that follows a different process that goes through the tag. There's a selection of a number of delegates and a head of delegation, and that is one cohesive U.S. perspective that goes forward to those plenaries. So hopefully that has helped to provide a little bit of clarity on the difference between participating in a tag and participating at the international level directly. We do intend to keep providing information and education about the various roles in the AAMI work versus in the international work. And I think in a future AAMI Standards Insider webinar, we're also going to cover some of the roles that are happening at the international level. There's a little bit of difference between the roles at the ISO level and the roles at the IEC level. And we know this is an area where some people might have only worked on the IEC side or only on the ISO side. So we'll help to increase everybody's understanding about that. Increasingly, we're seeing joint working groups, so it's useful to know what the different roles are and the way things operate. Okay, so with that, I wanted to shift into a look ahead, top 10 things to watch for in 2022. So this is not all of the activity that we expect to have happen next year, but it's a few of the big things that we wanted to get on your radar. So the working group that is responsible for developing the revision of AAMI ST91, flexible and semi-rigid endoscope processing in healthcare facilities, has completed their work. It has cleared the AAMI Standards Board, is going to ANSI. So we're anticipating, hopefully, that we'll have a publication of a new edition out next year at the latest. We're also looking forward to publication of the joint project between AAMI and BSI. On the AAMI side, this is going to be a technical information report, TIR 34971, Machine Learning, Artificial Intelligence, and Medical Devices Considerations for Risk Management. BSI, my understanding is they're planning to publish it as a standard. We also have the AAMI FDA BSI International Conference on Medical Device Standards and Regulation to look forward to. That's going to be April 27th through 28th in Arlington. We are planning it as an in-person conference, and so hope to see everybody there. We also are going to have quarterly AAMI Standards Insider webinars moving forward, starting in February, and going February, May, August, and November. It'll be the third Thursday of each month, so hope you will join us for those. We have already started to return to in-person standards group meetings for the AAMI committees. Hopeful that we'll be able to return to in-person meetings for the international groups as well. When I say in-person, for any activities that we're hosting, any meetings that we're hosting at AAMI, those will be hybrid. If we have an in-person component, we'll have an online component also. We do know that there is increased demand for people to have virtual participation options. So at the AAMI offices, we are happily able to provide that. You can also expect to see more education resources and articles that are based on new and revised standards that are being published. So we want to do more to help all of you understand when there's a new document coming out or when there have been changes to an existing document, what those changes are, what that means for you. So you can expect to see more around the release of new standards, new technical information reports, new consensus reports, and so on. We also recently revised and had accredited by ANSI our AAMI Standards Program Policies and Procedures. And this document provides the overarching rules for how our program operates, and there's a number of, I guess, corollaries to that, or ancillary documents that are based on the content in our policies and procedures. So you will see updates to some of our other guidance material that's out there, and it's available on our website. And one of our first priorities is to update the AAMI Standards Co-Chair Guide and our new member resources so that we can help our leaders of our groups and our new entrants to standards development through the AAMI committees come up to speed quickly on what roles and responsibilities are, how this all operates, and what platforms we're using to conduct our work. We're also anticipating making additional improvements to the new AAMI Committee Central Platform. We rolled it out in the summer. We've been working with it for a few months. There's some things that now that we're up to speed, we're hoping to tweak to make things a little bit easier for you as the users and for AAMI as the administrators of our standards program. Fewer clicks to get to where you need to go is a good thing. So that's what we're working towards. We're also planning the development of a next generation AAMI Standards Roster Manager tool. This was something that we had a few years ago that we had to retire when we moved to a new association management system. It didn't integrate anymore with our previous iteration of the AAMI Committee Central Platform. So now that we have reached stability for our new association management software, and we're getting there with our new AAMI Committee Central Platform, we can start developing a tool that will allow you to manage your participation in the AAMI committees much easier and on your own, on demand. And we're also expecting to grow the AAMI standards team. So we do have a new position that we're in the process of hiring for. That position will be working under Overdue Montanu. We'll work in the general standards side of the house, and we'll take on some of the sterilization projects and a few others as well. So looking forward to adding a new person to our team next year. With that, I also wanted to let folks know that we are going to be saying goodbye to one of our longtime employees, Cliff Bernier. Director of Standards has been with us for 30 years. He's worked with a number of the groups in that time, been an absolutely amazing colleague to all of us. And he is going to be retiring, so we wish him all the happiness in the world and hope all of you will join us in wishing him well as he moves into the next chapter of his life. So thank you, Cliff, for all that you've done for us and all that you've done for the AAMI Standards Program and our members.
Thank
So
you.
Thanks. So a few other things that we wanted to mention to this group. Just news from around AAMI in general. Each year, AAMI recognizes innovators whose efforts have moved the industry forward and rewards them with awards, grants, scholarship programs. So we're now accepting submissions for the 2022 AAMI Awards, and that'll be open through Friday, January 21st. You can find more information about the different awards and the application process online. I put the URL here. It's aami.org membership /awards. And I really want to encourage you to consider nominating your colleagues for the Standards Developer Award or the Technical Committee Award. We look forward to seeing those nominations every year. Also a reminder that the call for proposals for the 2022 AAMI FDA BSI International Conference on Medical Device Standards and Regulation is open through December 8th. You can find more information about how to submit a session proposal on our website. If anyone is interested in writing about standards activities for AAMI publications, such as putting together a short blog post, an AAMI news commentary piece, or an analysis or review for AAMI's journal, BINT, we would encourage you to contact Gavin Stern, AAMI's editor-in-chief and director of publications and media relations. He can be reached at gstern@aami.org, always looking for new writers and new topics to feature. We're also looking for a few bright ideas. Submissions are open through December 31st, 2021. I put the URL there, but you can also get to it through our website. To apply, you would simply identify a challenge that you faced, how the problem was solved, and the positive result that you achieved. The more details you can provide, the better. From the submissions that are received, the Technology Management Council, or TMC, selects 6 submissions to be profiled in AAMI's publications through 2022. So this provides really great visibility to those 6 finalists. And one of the 6 finalists is then selected to receive an Excellence Award at AAMI's annual conference. So it'll be presented at the next conference in Long Beach, California. So just a reminder, since the top 6 submissions will be profiled for AAMI publications, you will be interviewed by an AAMI editor. So there's some production demands. So just some things like you'll have your photo featured. And a reminder that we're not just looking for HTM submissions. Other submissions are welcome as well, including sterilization. So with that, we're a few minutes early, but we've reached the conclusion of our program today. So I want to thank everybody again for joining us for this edition of the AAMI Standards Insider webinar. It will be available on our website. So if you want to go back and take a look through, revisit the conversations that we've had today, or if you want to point a colleague who wasn't able to attend today to the recording, it will be available very soon. And just a reminder that the next one will be February 17th, same time, 1 to 2 p.m. Eastern time. So hope you will be able to join us then. And with that, I want to thank everybody again and wish you all very happy holidays. And we look forward to reconnecting with you next year.